Let's talk about the rehabilitation for patients who come in with an arthritic knee. First of all, we have to understand that every patient with an arthritic knee has an abnormal gait. And that's because they've favored the knee. The joint either doesn't move fully, or it's become weaker or more painful. And so to protect that joint, they walk with either a little bit of a limp or a protected gait or in a narrow range of motion so that the joint does not go through the full normal arc. Just like the tires on your car, when it's out of alignment, the tires wear off faster. Your knee joint wears off faster when you walk with a bad gait, and also your hips and your back become painful. So it's very important that all patients with knee arthritis get started on a careful physical therapy program and a careful exercise program to strengthen the muscles around the knee and around the hip and around the back, to strengthen their core muscles, and to improve their range of motion. We start all of our patients on this program before surgery and continue it on the first day after surgery and then for the rest of their life. The second thing that's most important about people with knee arthritis is that optimizing their weight is extremely important. Let me explain why. Normal people take between 2 and 3 million steps per year at up to 5 times body weight, depending on the height of the step. So if you lose 10 pounds, that can be up to 50 pounds on your knee 2 to 3 million times per year. So a tremendous amount of force can be taken off that joint by just lowering your weight. Also, by strengthening the muscles in your knee, the muscle groups take up more of the force than the joint surface when they're strong. Therefore, you decrease the wear and tear on the joint surface, and that's why muscle strengthening is so important to decreasing the pain of arthritis. The old advice where we used to tell patients to go home and rest their knee and wait for a total joint replacement is completely thrown out the window now, because we tell patients, don't go home, go to the gym, start exercising, start on a weight loss program, improve your range of motion, and your joint arthritis will feel much better. We teach people how to lose weight as well. Combined with a good exercise program, we encourage all of our patients to increase their water intake. The easiest way for our patients to diet is to drink 2 tall glasses of water before they lift the fork at each meal. No eating between meals, an hour of exercise each day, and then they can eat what they want at the meals. The reason for this is the water increases their sense of fullness. It acts as portion control. You eat less at that meal. That, when combined with an hour of exercise, will lead to usually a 1 pound weight loss each week, which is a safe way to start to lose weight and increase your exercise. All of our patients with arthritis get started on a weight loss diet, an exercise program, a rehab program for their gait and range of motion before we start on the surgical path. And then many of our patients can avoid surgery. Additionally, we start all of our patients on glucosamine. Glucosamine, in the form of a beverage such as joint juice, can decrease the symptoms of arthritis, decreasing the pain, decreasing the sense of stiffness that patients with arthritis feel. And it's not just patients with arthritis. Our athletes notice that when they use glucosamine, they feel less stiff the next day. And this is very important for athletes who want to compete day by day, or our pitchers who want to recover fast after throwing a lot of fastballs. So glucosamine is an effective way of decreasing stiffness, decreasing pain for our athletes and for patients with arthritis.